Hi, welcome to Socialpost Health Channel viewers. This is Dr. Chava Anjaneyulu, Senior ENT Surgeon. I am working with the Asian ENT Care Center located in Panjagutta, Hyderabad. Asian ENT Care Center is having all the facilities to diagnose and treat all ear, nose, throat problems, that is ear discharge, decreased hearing, tinnitus, vertigo, decreased sensation of smell, sinusitis, nasal obstruction, adenotonsil problem, voice problems, especially hoarseness, dysphagia. All we treat with advanced technology. We have the lasers, coablator machines. So this will help to treat our condition very perfectly. Now we are seeing many patients coming with vertigo problem after COVID infection recovery, especially those who have diabetes, hypertension, hypercholesterolemia, any other autoimmune disorders. These patients are having more chances of the vertigo problem after COVID recovery. This is mainly due to COVID has the affection to get attracted by the cochlear and vestibular cells. So in COVID patient there is a more chance this infection will go to the inner ear and cause infection. Along with this infection, if the patient has predisposing factors, those are diabetes, hypertension, hypercholesterolemias, any vasospasm problems, this will increase the COVID effect. Mainly in inner ear, the problem is due to hair cell damage, that is vestibular hair cell damage and blood vessel constriction. These two factors will cause the vertigo problem after COVID infection. If blood vessels already narrowed because of diabetes or any hypercholesterolemia or atherosclerotic patches, this COVID minimal inflammation also cause a complete problem, and that's why patient will get dizziness problem. In autoimmune disorders also already there is inflammation in the ear which increase the effects of the COVID. So COVID patients with other health problems will have more chances of vertigo problem. Usually these patients initially they will focus on the recovery of the COVID infection. Once they recover completely from the infection after 2-3 weeks, and they will focus on the dizziness or vertigo problem. After once he recovered, his general condition improves, he becomes numb, then he will focus on that and he will say, I am having vertigo problem or a hallucination of the movement. In these patients always we have to do the vestibular function test to check how the vestibular function is there. If there is a damage to the vestibular function, these tests WEMP and video nystagmography show the decreased response. So that is hypofunction of the vestibular system. Once you diagnose that system, then you treat the patient for vertigo. In this treatment, once we diagnose, we treat symptomatically to reduce the vertigo, and simultaneously we treat the patient to increase the recovery of the outer ear cells and blood vessels. For this purpose, we give some vestibular suppressant drugs, that is beta-histamine, to reduce the function, irritation of the vestibular system, thereby he will have less dizziness and vertigo. And we have to give some vasodilators also to increase the blood flow in that area by vasodilatation. Canaurin tablets or tramadol we will give that injection, Trentol and vasodilators. This will cause vasodilatation. Most of the times patients, if you get treatment with vasodilators and vestibular suppressants and antioxidants, his dizziness will improve. Along with this, we give some vestibular rehabilitation exercises also to compensate and to increase the function of the vestibular system. Rarely patients have persistent vertigo. We give injection of platelet-rich plasma into the ear. These injections will contain growth factors and vasodilators. These growth factors and vasodilators directly go into the ear, and it will increase the recovery of the vestibular cells and increase the blood flow. thereby patient vertigo will decrease. So if you have any problem of the vertigo post COVID or otherwise, contact Asian ENT Care Center. Here we will do all vestibular function test along with radiological investigations. Once we diagnose the condition, we treat by both physiotherapy, that is vestibular rehab exercise, medical management, if need intratympanic PRP injections.